Good day, viewers. You are welcome to Olusegun Adewale Towobola YouTube channel. I want to beg of you to please subscribe to this channel. Also share this video and make comments. You are welcome to our program on health matter, health creation. Many people today are going about wealth creation, but at the expense of their health. What is the benefit of health? What is the benefit of wealth without health? Because if you make money and your health deteriorates, you are going to use your money to recover your health, and sometimes you will not be able to recover it again. In the studio with me today is a doctor, medical doctor, Dr. Adetutu. He's going to deliberate with us about a very crucial topic. Our topic today is depression. What is depression? How prevalent is depression in the society? How can we manage depression? How can we receive cure from depression? Maybe you are having that issue, or one of your loved ones is having the issue. What is the way out? You are going to hear a lot today. So stay tuned. Don't turn the dial. I want to advise you that you are going to enjoy this program. And let me welcome our guest to the studio. You are welcome, sir.
Thank you so much, sir.
How is everything, sir? How is family?
Fine.
Please, can you introduce yourself to our viewers?
My name is Dr. Adetutu Joseph. I am a family physician, a consultant family physician. I work in a private hospital in Basa, in Jos, Plateau State.
All right, sir. Please, what is depression?
Now, depression is an affective illness. When we say affective illness, illnesses that affect the mood. Depression, although it's a psychiatric matter, but it's a big issue with primary health care. And that's why I'm addressing it from the primary health care angle. Depression is a illness that causes depressed mood, loss of interest in things that used to be pleasurable to an individual before, poor sleep, and some other signs that we see. It's a very big issue in the community because depression has been misconstrued by many people. Many people think it's a lack of willpower, weakness on the side of the person who suffers the illness, and that has caused a lot of misconception, and it affects the treatment of the illness. So depression is a sickness that affects the mood, and it's a treatable sickness. It's a sickness that can be treated completely. That's a very important thing. It can be treated completely. Unfortunately, because we don't handle it well, a lot of cases of suicide and parasuicide have resulted from poor management of depression.
I think I got that. That's the good news that it can be treated. I think that's the good news. Depression can be treated. It's not supposed to lead to suicide or to other complications. Sir, how prevalent is depression? And what factors contribute to its occurrence in the general public?
Now, depression is a very prevalent disease. It's very prevalent in the community. The statistics puts depression at about 18 to 20% in the community. Now, depression can be divided into three categories. There's a minor, there's a major depressive illness, which accounts for about 2% of depression, and that's the one that usually leads to suicide and other debilitating factors. Depression, major depressive illness can also come with psychiatric manifestation of psychosis, like a mad person. Major depressive illness can also come up with that. But there is a mild and a moderate form of depression too. But generally, depression accounts for the prevalence is about 18 to 20% in the community.
All right, you said there is minor and there is major.
Yes.
So how can we differentiate between minor and major, sir?
Now, like I said, the mild depressive illnesses, they are the ones that usually they don't last very long, and after some time, even without medication, after some time you may be able to get over it. The mild depressive illness, there are scores, there are criteria that we score for when we're diagnosing depression. There's a diagnostic tool we use, PHQ-9, and that's primary health questionnaire 9, that we use to diagnose depression. And there are scores that will tell us that this depression is mild. And for mild depressive illness, there are things that even with just psychotherapy, just talk therapy, walk therapy, giving them coping mechanism, cognitive behavioral therapy, you can actually get over them even without medication in some cases. But once you get to the moderate and the major depressive illnesses, you may have to use drugs, and in some cases may require admitting the patient for some time, and the treatment is usually longer. And if care is not taken, those are the ones that lead to suicide.
All right, sir. What contribute to occurrence of depression in the society?
Yeah.
What are the causes?
Now, the causes are numerous. Some of the causes you cannot lay your hand on it, but some of them we know. There's a genetic predisposition to depression. It's been found that when it occurs in some families more than others. Now, some other causes that you may not be able to say when people have some other common causes when people have sicknesses, major sicknesses. For example, somebody has a stroke, it can lead to depression, or a major sickness. Somebody has a cancer, a life-ending sickness. It can cause depression. Even some socio-economic factors like loss of job, loss of a major source of finance, family discord, pressure, tension in relationship in family. Those things can lead to depression. But there are some other causes. For example, it's been found that people who grew up with a single parent, especially with the mother, without a father figure, are more prone to depression than people who grew with both parents. Then again, use of substance can also predispose people to depression. So there are so many other factors that I may not be able to point out, but those are some of the factors that may cause depression.
All right, thank you, sir. All right, can you explain the difference between situational sadness and clinical depression for better understanding?
Now, we are all human beings, we are emotional beings, and sadness is part of the emotions we experience. Now, to make a diagnosis of depression, the individual must have had symptoms of depression for at least 2 weeks, for a minimum of 2 weeks. 2 weeks for most of the time in those 2 weeks. And now, major criteria that will affect the diagnosis for depression, that will help us make a diagnosis of depression, is loss of interest in things that were pleasurable to the individual before. So somebody who loves to watch football, for example, suddenly does not even have interest at all in football. That's a major factor. And then the other major factor is depressed mood. You just see that the person has depressed mood, is not talking, is not relating well. Even just looking at the person, you notice that the person is not in a happy mood. Those are major factors. But there are other factors. For example, poor sleep. When an individual is unable to sleep well anymore, might be a factor. Psychomotor agitation, when a person just gets agitated, that can also be a factor, a symptom of depression, I mean. When an individual has lost appetite, he doesn't even want to eat anymore, and then there's unexplained weight loss. That can be a symptom. That's also a symptom of depression. Now, for situational conditions, now,
because
usually,
my next the difference between situational sadness and depression.
Now, for situational sadness, what happens is that you actually know the cause. For example, somebody lost a close relative. Now, that person is grieving.
Not depressed.
Even though he has symptoms that look like depression, we know that the cause is the grief. But unfortunately, if grief can also progress and become abnormal grief, and then may lead to
graduate into depression.
Yes. So, but situational sadness, usually you know the cause. There's something that is causing the sadness. For depression, you may not be able to know the cause. And you remember that I say some of the causes of depression is like you have lost a loved one. It can also lead to depression. Usually, situational sadness will last for a shorter period of time. The person gets out of the mood. For example, you lost a loved one. After 2-3 days, you're able to eat well, you're able to function well. But maybe after a few days, you lapse back. That is situational sadness. But for depression, you remember I said the symptoms must last for at least 2 weeks.
2 full weeks.
Yes.
If it's more than 2 weeks.
2 weeks or more. Yes. If it is more than 2 weeks, then we are tilting towards depression. But for situational sadness, usually there are times when your mood is elevated, and maybe something happens, you remember the cause of your sadness, you go back. But for depression, the mood is continuously down for about 2 weeks.
For 2 weeks,
yes,
and more down.
Yes.
So that is when we look at depression.
Yes.
I think we can get it now. Situational sadness is up and down.
Yes.
So, and it doesn't last, but whenever it lasts for 2 weeks or more than 2 weeks, we are dealing with depression.
But you remember I also said grief. When you are grieving, you can grieve for a long period of time. But grieving, once the grief is extensively prolonged, then it becomes abnormal grief. Some people grieve for more than 6 months. Some people, once it's getting to that stage,
continuously.
Yes.
So that is depression. All right. Yeah, let's go to our next topic, which you have touched, is about what are the signs and symptoms of depression.
Yeah.
What are the signs? So please, I want you to tell our viewers.
Now, like I said, there are major signs for depression. And those ones include reduced mood or a depressed mood. When somebody, you just notice from the affect, from the look on the face, this person is not elated, is not excited, he is depressed. That's depressed mood. And majorly, loss of interest in things that usually were pleasurable. Things that were pleasurable to the person before. Somebody who loves to eat, who enjoys his food, suddenly does not even want to take the food at all. Somebody who enjoys to play lawn tennis, who enjoys to take part in sports, does not want to get involved in sport anymore. Those are major factors that are symptoms. But like I said, the other symptoms would include, we call it psychomotor agitation, when somebody is just agitated, loss of appetite, weight loss. Those are other symptoms. Poor sleep, lack of sleep. But I must also mention here that there are signs and symptoms that may present. There's a type of depression that is called atypical depression.
Atypical depression,
where the person instead of not having loss of appetite, you actually have an increased appetite. Instead of having weight loss, you actually have increased weight gain. And instead of having poor sleep, you actually sleep too much. So that's in case of atypical depression. But usually in depression, there will be poor sleep, reduced appetite, and weight loss.
Well, our next topic is like you have touched the topic talking about how does one distinguish between feeling down due to life events and experiencing a more serious depressive mood. If I could understand you very well, you said when the grief goes beyond 2 weeks.
Yes.
So
when the feeling, now, whether you like it or not, life events will happen.
Yes.
Life events will happen. Why some of us can just get up and go, some people will mourn over those events. Now, when you mourn over the events, usually, no matter how much you are mourning over an event, maybe loss of a job, or usually after 2-3 days, you must be able to take food, you must be able to at least take your bath, walk around, life will continue. But when the coping, you're unable to cope with a particular life event, say loss of a job, and then you refuse to brush your teeth, to take your bath for 3 days, 4 days, you're indoor, you don't want to talk to anybody for the next 4 days, 5 days, 1 week, and you are going to 2 weeks. Of course, that is no longer life event. Now, another major symptom of depression that I forgot to mention is suicidal ideation. That's thinking of suicide, planning to commit suicide, or even attempting suicide, or even committing suicide. Those are also signs of depression. So when you are feeling down and then it's getting to the point that you are planning suicide, you are trying to kill yourself, then of course you are not dealing with any life event anymore. You are dealing with attempted suicide.
Thank you very much. Thank you, sir. But talking about suicide, I want to say there are cases where rich people that it looks as if they are doing well, they are millionaires, and they committed suicide.
Now,
does depression affect everybody?
Now, it must be noted that depression affects everybody. The funny thing is, even children have been noted to have depression. Depression has been diagnosed in children. Now, depression does not care whether you are a billionaire or you are a pauper. Depression affects everybody. Everybody. It can affect anybody. Let me not say it affects everybody, but it can affect anybody. Any spectrum of whether you are poor, whether you are rich, depression can affect anybody. So it's not about being a millionaire or a pauper. So there are things that help us cope. For example, there are factors that help people cope. It's been noted that people who have more family around them tend to have less depression compared to people who are alone or unmarried. People who live on their home tend to have depression more than people who are amidst people. Funny thing, people who stay away from sunshine actually tend to have more depression now. Now, there's a particular type of depression that is called seasonal affective disease.
Seasonal affective disease.
Yeah, disorder. Seasonal affective disorder. Now, the seasonal affective disorder is actually commoner in winter when there is no sunshine. So people who are not exposed to sunshine more than others tend to have more depression. And so, of course, it goes to say people who are more social will tend to have less depression than people who are not. So those are part of the things that you must consider.
All right, sir. Thank you very much, sir.
Yes.
All right. What role does genetics play in predisposing individual to depression? And are there ways to mitigate genetics risk factors?
Now, there's this popular saying this saying that we use, we say the genes load the gun.
The genes load the gun,
but our lifestyle pulls the trigger.
Our lifestyle pulls the trigger.
Yes. So the gene
loads the gun,
but the lifestyle
pulls the trigger. Wonderful.
So somebody who is predisposed to depression, who now tends to stay on his own, does not relate with others, does not, it's likely that that person would have a depressive episode. But if you are prone to depression and you are always amidst people, even if depression wants to come in, it would be less. It won't be a major depressive episode. It may not be a major depressive episode. Now, that's not to say that at times people who walk around and don't suffer depression, some of these things you don't have control over them. The little things we can do to make our life, our experience better, we should try to do them.
All right. Yes. The word depressive episode is sounding as if, is it gradual? Does it graduate? Does it have steps?
No.
All right.
What is noted is that people who have had a depressive episode before can have a recurrence.
All right.
So that's why we call it depressive episode.
All right.
Now, there are other diseases that have depression as part of it. For example, bipolar affective disorder. You remember I told you depression is also an affective illness. So bipolar affective disorder would have depressive episodes and manic episodes. So somebody is very down and not up, doesn't want to, and maybe after 6 months now, very elated, he spends money anyhow, he wants to wear biggest clothes, he dashes money out and all of that. So that's a bipolar affective disorder. Depression is a depressed mood. Mania is increased mood. So bipolar affective disorder has both. That's why we call it bipolar. The two poles, the two extremes of the pole, depressive, manic. So,
extremes
yes, that's why we call it depressive episode. Now, when somebody comes with a depressive episode for the first time, you don't know whether that person may have a manic episode later. That's why it's called depressive episode.
All right. Can you discuss various treatments options for depression, including therapy, medication, and life changes?
Yeah. Now, like I said, depression can be completely treated.
All right.
Completely treated.
Yes.
But it is quite important that you make the diagnosis early. So, for an individual who has not come out for diagnosis, or for an individual who is alone, who doesn't relate with others, you may not even know that the person is suffering. Now, it's important that for individuals, if you notice some of these symptoms, you notice you are not just happy continuously, your mood is down, you are not interested in things that used to be pleasurable to you before. It's very important that by yourself, see a doctor. Now, the unfortunate thing with depression is at times, when a depressed person comes to see a doctor, he just complains about fatigue, which is one of the symptoms. That's fatigue. Just generalize that. I'm just tired. I don't feel like doing anything. Some of them complain of headache. Some people complain of palpitation because there is an anxiety component that can be part of depression. And at times, the primary health care person may not be able to identify that this person has depression. Because you have to be sensitive to this thing. Another thing that affects diagnosis so much is because most people have how do I put it? They have this misconception about depression, like this person is not spiritual enough, that's why he has depression. I can pray for him.
He doesn't have faith.
He doesn't have faith. He's not a Christian, he's not a Muslim, he's not a good person, that's why he has depression. Now, depression can affect anybody. We've heard of ministers of God.
I heard of pastor who committed suicide or attempted suicide.
Yes. In fact, many of we've had many people like that. So depression is not because you are not spiritual. And don't make that mistake that because you are not spiritual, that's why you have depression. Now, when you have depression, seek medical care. Now, like you said, there are different categories of care. You remember when I was talking about my depression, I said some of them just by cognitive behavioral therapy, just by psychotherapy, just by talk therapy, just talking to the individual may cure the person of depression. Yes.
Just talking.
Yes. So there are different categories of therapy. Psychotherapy, occupational therapy, that's getting him busy, taking his mind off. Those are simple cognitive behavioral therapy. Those are therapies that can change, that can be used, but those therapies are applied by trained personnel, not just anybody. Now, it's good to do counseling in church, but because the church counselor may not be trained in the matter of depression, it is always good to seek a healthcare personnel. Now, we've talked of therapy. Now, there are drugs, there are drug treatments. There are so many drugs, from the serotonin selective reuptake inhibitor to tricyclic antidepressants. There are drugs. There are drugs that you can use for treatment of depression, and varying drugs. So if you have a side effect to one, you won't have a side effect to the other. There are varying drugs that you can use for treatment of depression. Now, there is also the electroconvulsive therapy, which electroconvulsive therapy.
Convulsive therapy.
It makes the patient, it simulates convulsion. That's for severe depression with suicidal ideation, where you are thinking that this person may attempt to commit suicide. So that has helped a lot of people. So there are treatments. There are so many treatment options, and that's important to know. So usually the treatment will last between 2 weeks and 3 months. In some cases, it may last a bit longer, but usually it is curable.
Okay, but what do you say about self-medication? Because there are individuals that know this drugs is good, and they are using maybe for themselves or for their loved ones. What can you say about self-medication?
Now, the problem with self-medication is it's a lot. I don't even want to start going into it. Now, you must know that every medical drug, including vitamin C, including paracetamol, every drug has a side effect.
Every drug
has a side effect. Now, has some side effect, more than one in plenty cases. Now, not all medicines can treat medicine. You know, the problem with self-medication is you say you're having this symptom. I say, I was sick, I went to the doctor, I had something like that, and the doctor gave me, go and buy that drug. That drug works well. Or you just feel, I have a headache, you use the drug. Depression is not a diagnosis that most people can make on their own. In fact, even in primary health care, many physicians miss the diagnosis of depression. So it's not something you want to just use self-medication for. It's something that you want to make a proper diagnosis and proper treatment. So please, if you have anything that looks like depression, or you have someone who has a depressive episode, please make sure you see a doctor, a primary health care doctor, or better still, see a psychiatrist. But if you cannot see a psychiatrist, see a physician.
All right. How important is early detection in managing the treatment of depression effectively?
Like I mentioned, depression can be very serious, and I also mentioned that depression can come with psychosis. Psychosis, where someone presents, starts behaving erratically, cannot take care of himself, becomes a problem to himself, problem to the society. Now, you don't want to get to that stage.
That's true.
You want to treat depression as soon as it is possible. As soon as it is possible. Now, the problem is, you need 2 weeks to make a diagnosis. But in some cases, you are even sure that this is most likely depression even before the 2 weeks. So, as soon as it is possible, you can begin psychotherapy. You can begin behavioral therapy. You can begin occupational therapy even before full-blown depression. Don't forget that when depression stays long, suicidal ideation can come in, and before you know, suicide can actually come in. So most of the suicide that happen can be prevented. Can be prevented if we are sensitive to the people around us, and if we seek care for individual early enough. Suicide is not it's something that happens everywhere at any time. So please, if you suspect somebody is depressed, guide him to see a physician, a healthcare personnel, or a psychiatrist.
All right, thank you, sir. What are some misconceptions about depression, and how can we work towards reducing the stigma associated with mental health
now
in our society?
In the developed world, mental health has become is seen as part of your health. In fact, you can't say you are healthy if mentally you are not healthy. So mental health is a part of our health. We still have a long way to go in our community now. There's a general misconception in Africa, in Nigeria. There's a general misconception about
stigma.
Yes, about mental health. In fact, most people view it as a spiritual attack. It's a demonic attack. Well, while I would not argue with your spirituality, it is always better to take care of what is medically, and take care of the spiritually. But the mistake we make is because most people, instead of bringing somebody with a mental health issue to the hospital, will take the person to church. And before you know, for deliverance, before you know, the person goes completely out of hand. Now, while we are all spiritual people, what we know is that God answers prayer anywhere you pray. So you can have the person in the hospital and continue to pray in the church. It's a good thing.
Or even come to hospital
and pray for the person and go. That's a very good way of approaching it. But most of these illnesses, if they are treated on time, can be managed. So please, it's a very serious misconception to think that it is because it is a demonic spirit causing depression. It can happen to anybody. Now, it's a very serious misconception to think that depression is because the person is not strong. You are not man enough. What has even happened to you that you are thinking this like this? People have suffered more than that.
And they are standing.
That's a very serious misconception. It's a misconception to say it's because some enemies are after you. That's why you're having depression. It's a serious misconception. And it's a misconception to think that it is not treatable. Those are some of the misconceptions. Of course, there are many more that we may not be able to say.
All right, sir. How does depression impact physical health? And are there any long-term consequences if left untreated?
Yeah. Depression affects physical health in a lot of ways. Now, depression in itself causes your immunity to be depressed. So, and with depressed immunity, other illnesses, there's this popular saying in Yoruba land, they say when a big trouble falls you down, the small ones will climb on top. That's what happens with depression. When you are depressed, your immunity goes down, and other common illnesses that should not ordinarily affect you can begin to affect you. So that's one of the things that happen with depression. So with depression, other illnesses, I told you there could also be panic component and anxiety component to depression. Those are other illnesses that may start to creep in, apart from the infective illnesses that can also come in because you are depressed. Now, when depression is not taken care of on time, people can develop. That's when you see somebody plan suicide over time. I was hearing just about 2-3 weeks ago, somebody was telling me about a young man who finished with a first class in university and couldn't get a job for more than 3, 4, 5 years. And then he just told his landlady, he lived alone, he was living alone with the landlady. He told the landlady he was going to travel, picked all the certificates, burned them, and went into the room and took a poisonous substance that killed him. Now, that person must have had depression over time.
Yes.
This thing happened this year, just about 2 weeks ago. Must have had depression over time. And then, because he wasn't taken care of, because he wasn't treated, had time to plan his suicide. Probably even have attempted other means before that final means. So, treating depression on time would save a lot of life. So that's one major way of one major complication that can arise from depression. Now, remember I also mentioned that a bipolar affective disorder may present like depression, and if nothing is done, then the manic episode begins to manifest. But if it is treated on time, it can be cured completely.
Are we saying that only suicide is the terrible thing that can happen to depressed people?
No. Remember that I also mentioned that depressed individuals may present with psychosis.
That is what, sir?
Psychosis is what we call full-blown madness. That's the one you see on
madness.
The street. Yeah.
Can develop to that.
Yes. Now that's the general. Psychosis we call that's what makes that's the presentation. Now, other things that will also happen is that the individual begins to neglect himself. He doesn't shave regularly, doesn't take his bath regularly, does not brush his teeth regularly, becomes a problem to people around him and to himself.
Looking unkempt.
Very unkempt. And all of that, yes. So depressive episodes, if not taken care of on time, can affect the individual, can affect the people around him. A depressed person can get aggressive, can get agitated. So all of those things are part of the things that can happen. So usually, because it's an affective disorder, it may not present with the complications of the other thing, but like I told you, your immunity also is depressed, and if the immunity is depressed, other illnesses can come up, and then the end result may not be very good.
All right, sir. Is depression the sickness of a black man, or does it affect white men also?
Well, depression affects all races.
All races.
All races, and the prevalence has been found to be similar in almost every race. So,
including developed
world. And part of the prevalence I must mention is that depression is commoner in women than men, but suicide is commoner in men than in women. In fact, the suicidal for depression to lead to suicide in men is about 4.5 times more prevalent in men than in women. So yes, depression affects every tribe, every race, almost the same way. In fact, I would say that we in Africa have a hedge over them. We have some factors that protect us better than them because of the communal life we live.
Okay.
I may not have money, but my children will still go to school because one uncle, I can meet one uncle who me pay some of the school fees. I may be sick and go to the hospital without money, and people will come around and bring food and pay 2,000 here, 1,000 here. Over there, you are almost strictly on your own. So that's the loneliness part. Is one part that plays, and you know, because divorce rate is also higher among the whites. Remember, I told you divorced men, divorced people, divorced individuals tend to have more risks of depression, and then lonely people. In Africa, you hardly find people who are lonely. It's hard for you to be completely lonely, even though we are trying to imitate the West. But that loneliness is so common over there. So depression is even more common among them than
among the whites.
Yes, I mean they have risk factors, more risk factors that will predispose them to depression than the black man has. And like I told you, the communal kind of living we live also helps us cure some mild depression that we may not even know. We may never even get to know, because before they will get bad enough, the people in the community have taken care of and been able to take care of it. So yes, depression can affect any race. It can affect any. It's not commoner in the black than in the white. It can affect anybody.
Any race. Yes. Thank you very much, Dr. Adetutu. I asked that question because we have viewers in Nigeria, in India, in United States of America, in United Kingdom, and all over the world. About 60 nations are watching this channel. So, before we leave the studio, sir, what is your final word to our viewers, both in Africa and Middle East, Asia, and United States, United Kingdom, all over the world? What is your final word, sir?
Now, my final word is, number one, take care of yourself. Your mental health is part of your health. In fact, if you are not mentally healthy, you are not healthy. Seek medical help. Avoid anything that will stress you. You know the things that can stress you. Avoid them. The economy generally worldwide is not palatable now. It's not friendly. But God is our help. Live within your limits and be satisfied with the little you have. Try and seek health. Seek mental health care at any time, regularly. Visit your doctors, talk to people. When you notice something is stressing you mentally, talk to people, and that may be your saving grace. If you notice anybody around you being lonely, locking himself in every time, try and discuss with them. You may be able to make a diagnosis of depression, and you may be able to save a life. Stay happy. God bless.
Thank you. On behalf of our viewers, I want to thank you, Dr. Adetutu, for coming to share this light on health with our viewers. Viewers, you have heard everything that he has said concerning depression. Is a terrible disease in the community, and it is in disguise, because it is not like other sicknesses that will bring somebody down. So one can be keeping it, but it's very, very dangerous and very deadly. Please take heed to all that you have heard, and we believe that you are going to have a sound health, even as we are moving to create wealth. Let us try to see to our health as well. So thank you for watching this channel. I still want to beg of you to subscribe to this channel. Also share this video and make comments. If you have any questions, please send your question through our comment section. We attend to your comment, and if it's medical questions, I will reach out to our doctor and to be attended to. Thank you for watching this channel. See you another time. Take care of your health. Bye bye.